Hello everyone, my name is Natasha Fowlks. I'm the Executive Director with Visiting Nurse Hospice Atlanta. Most people in my position, fall into this somehow. It's never just an organic, graduate from college and just say, oh, I want to wake up and become a hospice executive director. That just doesn't happen. It's definitely a calling. It's not work. It is service to the highest level. It is not something for someone that's going to come in and think that it's an 8 to 5 job, Monday through Friday. This is our life. We live to serve. We live to take care of folks in their most vulnerable time. I am the Executive Director for Hospice and Palliative Care. And it's important to note that there are two separate divisions, two separate service lines with two separate entirely different functions. So the hospice program is mainly centered around caring for those with a life-limiting illness with 6 months or less. And what that will look like is that person will be placed in an interdisciplinary team with a social worker, a nurse, a chaplain, end-of-life doula, mental health providers, supervised by our medical director, CNA services. We care for the patient and their family in its entirety for most needs that they may have, including durable medical equipment like hospital beds, oxygen needs, that sort of thing. It's a tremendous value. This benefit's been around since 1983. What is unique about hospice is most of our patients do much better with it. There's studies that show that people with hospice care actually live longer and have a better quality of life than not having it. So demystifying hospice is just a whole reason why I am here in my role, just kind of getting the word out that hospice is here to heal and to care. With regards to palliative care, so palliative care is a phenomenon where we provide expert symptom management in the home or wherever the person calls home. It's led by our medical director. The nurse practitioner is the provider out seeing the patient, providing symptom management. It also includes a social worker and access to a chaplain. The difference between hospice and palliative care is hospice is life-limiting for 6 months or less, and palliative is 1 year or less. And those folks have a chronic illness or terminal illness, but still seeking aggressive care. So that's a huge differentiator.